Hello. My name is Dr. François Ricard. I am an osteopath and a PhD. I am director of the International Madrid School of Osteopathy, EOM, and president of the Scientific European Federation of Osteopaths, SCFO. In this video, we will talk about the segmentary passive mobility tests for the thoracic and lumbar spine used in osteopathy, also called mobility tests and dynamic palpation tests. There are few scientific publications on these tests for lumbar and thoracic levels. According to Burns et al., 2016, in patients with cervicothoracic pain and shoulder pain, in the cervical spine mobility tests, the percentage of agreement ranged between 48% and 76%. The kappa coefficients ranged between -20 and 0.58 for the evaluation of joint mobility in the cervical and thoracic spine. Reliability varied considerably for cervical or thoracic examination, and was much better for shoulder joints, kappa of -0.24 and 0.83. According to Brismy et al., 2006, the inter-examiner reliability for a passive intervertebral mobility test in the middle thoracic spine ranges from fair to substantial. The results were the following. Agreement percentage from 63.4% to 82.5%. Kappa from 0.27 to 0.65. The results for the intervertebral passive mobility tests are reliable enough to assess the passive segmental mobility in the middle thoracic spine. According to Walker et al., 2015, the results for inter-examiner reliability were poor for movement restriction and pain. There was a poor low level of agreement between examiners, both for joint stiffness and pain location. In the systematic review by Najm et al., 2003, in general, the sensitivity of the studies, which evaluated the range of tests for motion and pain provocation, varied greatly. A lack of sensitivity was reported for range of motion studies, not due to the experience of the examiner. Slightly better sensitivity, 82%, was reported in one study. It is recommended to use a combination of mobility tests and pain provocation. Conclusions. It is recommended to use a combination of pain provocation tests and active and passive segmental mobility tests. The most reliable is to use clusters with combinations of segmental mobility tests. There are few studies on this subject in the lumbar and thoracic level. It is recommended to carry out more rigorous controlled studies, to study the inter-examiner reliability, sensitivity, and specificity of these tests. To avoid biases, it is imperative that the examiners are well trained in carrying out the tests to be studied. This is rarely the case. There is a lack of criteria in the performance of tests at the thoracic and lumbar level. Adequate training would be necessary, particularly in non-osteopathic manual therapy and in physiotherapy. Here you have the scientific references used in this lecture.
Thank you for listening.